Hello and welcome to my podcast. Over the next period of time, I'll be going through a number of interesting issues in dentistry by giving some podcasts. And today what I'll do is I want to start off with gum recession, which is a common thing that I see in the office. So the first thing I'll say is what is gum recession? Well, gum recession is where the gum, which forms the protective framework of the tooth, begins to recede, exposing part of the root, and we call it the root dentine. Now, before I get into the causes, what we want to do is talk about the general overview. Overview in the sense that the gums are, although your oral health is an indicative feature of your general state of health. In many cases, gum disease can be linked to high cardiac or cardiac disease, heart disease. And as well as poor oral health can give feelings of bad breath, halitosis, and low self-esteem. So it's a good indication as to where you're at in relation to your health. So coming back to the original gum recession, there are pretty much four main areas which can cause gum recession. The first thing is us as people, us as patients, where we utilize the wrong brushing technique. In some cases, some of us brush too hard, or have the wrong type of toothbrush with the bristle strength, and that can cause abrasive trauma when you brush on a regular basis. That can cause bleeding gums and the gum to be lost, i.e. stripped back, and that can be unsightly as well as sensitive. The second cause is suffering from gum disease. This can be caused by a multitude of things, wrong diet, poor brushing technique, lack of professional help in terms of seeing a dentist and a hygienist on a regular basis. And of course, third one is called what we call anatomy. We're all born differently. Some of us have long hair, others have short hair, others are pale in colour, others are not. And the same can be applied to the gums and also your bone structure. Some people are born with very thicker gum tissue, and others the gum is thin. Now, if your gum tissue is relatively thick, it's going to be less likely to recede given the same trauma as somebody with thin gums, which is more likely to recede. We as dentists call that the biotype. So the thicker the biotype, the more resistant you are. Also, we also have differing amounts of bone around your particular teeth. I often say, if we look at the framework, you have your gum, underneath the gum you have the bone, and then you have the tooth anchored to that. Now, gum and bone are very good friends, that where the gum is, the bone sits pretty much 2 millimeters underneath in all dimensions. So in some cases, if that anatomy is wrong, then you can be predisposed to recession. The other cause is simply things such as we just don't know. We call it itogenic. We have a lot of reasons to be confident with the competence and the health of your practitioner, but there's some things in medicine that we just don't know. Now, ultimately, when someone suffers from recession, it's going to be a combination of one or more of those factors. Whether it is the brush too hard, they have gum disease, or they've had traumatic things such as braces put on, and typically in the lower anterior area is something that we often see. So the first cause, when someone goes to their dentist complaining of symptoms of sensitivity or gum recession, etc., is to try to identify the cause. Once that cause is identified, then we can begin to formulate a treatment strategy. Now, treatment strategy can range from the very, very basic to the more complex. The basic would involve, in terms of using the right toothpaste. Sensodyne is a market leader. Using the right brushing technique, where dentists or hygienists can discuss that with you. Seeing the dentist and hygienist. In some cases, your dentist can use little fillers to seal over the exposed root tissue, which can cause sensitivity. Or in more advanced cases, or cases where it causes an aesthetic compromise, one can utilize gum grafting procedures. So that's really much the first podcast that I'll do. I'm just talking to you about gum recession, what it is, how it's caused, give you a greater understanding, and what your options are. Thank you very much.